Welcome to Planstreet Case Management Software. Today we'll be reviewing our system and discussing how we can manage mental health service patients using our software. The first screen that we will review is our case grid screen. From our case grid screen, we can review active cases, we can review archive cases, which show us old cases within the system, or we can review new applicants that have applied to be part of the organization. To review an active case, we simply click on the name and it will load the case information for us. Once the information is loaded, we will be taken to the case board. From the case board, you will see all of the programs that have been applied to this client. Each program is comprised of different activities that have been designed to custom manage this person's case. By clicking on an activity, I can see the details of the activity. I can see who has been designed to work it. I can assign a form. I can add a note. And save the activity so that it is updated for the next person that needs to come along and review it. The case board is customizable when you create a template in the system. Every organization has the ability to create their own that is custom to their organization. Another part of the case grid screen is to add a new case. By clicking the Add button, it will take us through the intake process. Here we will add a client. We will establish a start date. We will choose a template. We will assign an owner. This person will be responsible for managing the case. We will assign a team that will be responsible for working the case. We can assign a donor if needed. We can also choose a category to apply if it's needed. Here you can add a background story or some sort of note that would help you in your case management for this client. Down below, you will see the custom intake that is set up upon your onboarding that will be just for your organization and what you require. Once the information is filled out, you can save it, and this client now becomes an active case within the system. Once they're an active case, you will see the case board like this. It will show up blank until you begin to add activities as you need them. You can add activities one at a time, assign the work, and then save it. You can also use the case board to hide and show certain parts of the program that you may need access to, or you can turn it back on if you need to get access again. One of the other parts of the case management software allows you to integrate the forms that you use to manage your clients. Those forms are managed over here in the My Forms section. You can see here a list of all the forms that we have put in for this mental health service case. These forms are completely customizable and completely reportable. Once you put them in the system, it collects the data, assigns it to an activity, and the information can be pulled out through reports later. This is a great way to manage the case using the forms that you already have. The next part of the software that we're going to review is the templates. Every organization has a unique template. For mental health services, there are certain programs that are unique. Here you'll find we've set up an assessment program, a stratifying risk program, a treatment plan, and you also see a review program as well. Each program has its own set of activities that can be customizable for every organization and can be set up from the beginning so that every time a case board is applied, these things are automatically applied to a case, making the case management easier for the caseworker themselves. Once you're done setting up your programs and your activities, you can save the file and it will be ready to apply to the next case that you have. Another part of mental health services might be establishing certain classes that your client may need to participate in. These can be set up at the program level by simply turning the attendance function on and then creating an activity card, such as therapy, where we can enroll the class and then we can enroll clients and track their attendance. Once we establish a class as part of the template, we can use the attendance function. From here, we can enroll the clients into the classes that we've created. First, we assign an activity such as therapy. Next, we're going to choose our instructor. Then we will pick a topic, which is a class. And the third is we will enroll all of the clients that are needed to be part of this particular class. Once we've gathered all that information, we can save the class, and we will see our class enrollees here, and we can go through and we can mark attendance and manage each client through the class. You can also export this screen to give you a report on attendance so that you can track which clients participated in class and which did not. Another part of our software that you may find useful is our calendar. The calendar or the scheduler allows you to manage your calendar and set up appointments and track to-dos that you might have during the day, the week, or the month. You can see here I can have access to a list of all the things that I have to do for this month. I can add a new appointment by simply just going in here, giving it a name, assigning it a date, picking a location, selecting people that need to attend, adding a description, add a form if I need to, and save it. Once it's saved, you'll see here that it's added it to the schedule, and I can come back and review that at any time. You can also share your calendar with your other coworkers, and you can see when their schedule is free so that you might be able to work with them to schedule something you might need. When it comes to mental health services, another feature that Planstreet offers is the ability to invoice. From this part of our program, you can create and manage invoices. You can see here a list of all the invoices that have been sent out. You can add a new invoice by clicking the new invoice, selecting a client. It will bring in their billing address, email, phone number. It will automatically be able to assign an activity if you have recorded time against that activity to bill it, or you can use the custom feature where you can put in something, new billing item here. You can establish your price, add a tax if you need to, add a description, and then save and send the invoice out to the client. Once it's sent out, you can see where it shows up here on our screen. It can be managed from here. You can track the status. If someone submits a payment, you can even go through the payments, and you can add a new payment into the system so that it can be updated accordingly. The final part of our system that we're going to review today is reporting. Reporting is essential to every organization. When it comes to case management, it's important that you can access your data that you've put in so that you can distribute your reports to the people that need to review them. Reports are custom and can be created as you need it based on the information that you have put into the system. Here you can set up some basic information to title a report, choose a logo, choose a style. You can choose if you want a graph report, a matrix report, which is just an Excel dump of the data that's input into the system. This particular tab here will report on the intake, or you can report on the forms. For a forms report, an example would be, let's put in our date range. We can select one or multiple clients. We can see here, it's asking for forms. It's showing us a list of any form that has been submitted into the system. We can choose all of the fields that are part of that form, or we can report on individual ones. Once that's selected, you can create the report. It will spit out the results over here. Next, you can export it to Excel, or you can export it as a PDF. This is how you'll get your information out of the system and into a usable format that you can distribute to those who you need. Thanks for listening to our demonstration on mental health services.